Good afternoon. My name is Anthony Silva. I'm a licensed psychotherapist, but for the last 14 years, my focus has been on the field of qEEG and neurofeedback. At my practice, Gray Matters in Connecticut, we've successfully treated thousands of children and adults and recorded literally tens of thousands of qEEGs. But before I show you examples of qEEG analysis and neurofeedback, I'd like to emphasize what makes this technology different. Unlike other forms of neuroimaging which require expensive and cumbersome equipment, all you need to record EEG and do qEEG analysis is an EEG cap, an amplifier, and a laptop. So all this can be done in an office setting or in the field, for example, in a school or a college, as we've been doing. So this technology is highly portable. It's sensitive. It's reliable, producing similar results time after time. It's specific, able to localize abnormalities in function and connectivity with incredible accuracy and detail. It produces measurable data for tracking improvement, either with neurofeedback or just tracking the natural progression of improvement from things like concussion. And critically, it leads to neurofeedback, which is an effective, solution-focused treatment to actually improve outcomes. So at this point, I'd like to introduce you to Karen, a 58-year-old lady who suffered from multiple concussions, the first when she was skiing in 2002, and the most recent in 2017 when she fell on a concrete floor, hitting the back of her head and losing consciousness for 5 minutes. 4 years later, she still reports symptoms of vertigo and issues with visual convergence, proprioception, and anxiety. So 4 years post-injury, the SW-Loretta analysis is highly consistent with Karen's current symptoms. Abnormalities in EEG power were found in the parietal lobes and in the occipital lobes, most significantly at Brodmann area 7, an area involved in visual convergence and proprioception, exactly the issues that Karen found most problematic. But it's the connectivity analysis that really shows us the power of this technology to identify the location of injury and its effect on function. In higher EEG frequencies associated with more active brain function, the qEEG shows clear differences in both coherence and phase, consistent with a localized injury. Increased coherence was evident in a relatively small area in the left parietal lobe, showing reduced functional differentiation in the injured area and therefore reduced function, with reduced coherence between this brain area and the rest of the brain, showing that it's functionally somewhat disconnected from other brain areas. Phase analyses show a similar pattern of localized change, with reduced phase times in the left parietal lobe indicated in blue, showing a lack of information flow and processing, and longer phase times to other brain areas indicating a functional disconnect between this brain area and the rest of the brain. But it's not enough to be able to see and understand a brain injury. Our goal is to use this knowledge to train these areas and to improve function, even if it's long afterwards when patients have almost lost hope of recovery. To do this, we create a neurofeedback protocol based on a patient's current symptoms. This is matched to the abnormal brain areas and networks identified in the qEEG. So we create a protocol to reward improvements in these areas and networks, and improve function and reduce symptoms. To illustrate the power of this approach, I'm going to show you 3 patients who started neurofeedback long after being injured and showed significant and measurable improvements in just a few months. This length of time since injury is to avoid mistaking the changes that we're seeing in function with the natural progression of recovery that happens sooner afterwards. And so that we can see that this is due to the treatment intervention, in this case, the SW Loretta neurofeedback. So our first example is Nikita, who is now 30 but was injured in a car accident in 2018 when she was 27. She lost her job due to anxiety, depression, and memory issues, and she's been unable to work since. She was assessed by qEEG in October 2021, 3 years post-injury, with current symptoms of issues with executive function, attention, mood control, and visual processing. So in line with her symptoms, an SW Loretta neurofeedback protocol was designed to reward improvements in EEG power and connectivity in brain networks associated with both executive function and vision, with a second qEEG recorded after 19 sessions of neurofeedback. So what you can see with the neuronavigator is an injury and dysregulation in the left prefrontal lobe at 2 Hz and also at 16 Hz in the right posterior part of the brain, consistent with a contra-coup injury. So what I've done here is I've put Nikita's left prefrontal lobe before neurofeedback and the same area after 19 sessions of SW Loretta neurofeedback 3 months later. And you can see that the dysregulation in power has gone from 1.57 standard deviations from norm to just over 1 standard deviation from the norm. And in the same way, the power differences in the right occipital, parietal, and temporal area have gone from 1.97 standard deviations from the norm to 1.27 standard deviations from the norm. In the same way, this is delta coherence pre-neurofeedback and post-neurofeedback. Pre-neurofeedback showing increased delta coherence in the left prefrontal lobe consistent with reduced function, which is significantly improved after 19 sessions of neurofeedback. And finally for Nikita, the same comparison with delta in phase. We have significant phase abnormalities in the left prefrontal lobe pre-neurofeedback, which have significantly improved post-neurofeedback. So consistent with Nikita's functional improvements that we could measure with qEEG, she's had a significant symptom improvement and she's now considering returning to work. So the second example I'd like to show you is of a lady called Therese, age 59, who was injured in her apartment when she was sliding open her window, which wasn't correctly installed, and fell down, hit her on the right side of her head. She's been unable to work since her accident and was assessed in December 2021, 6 months post-injury. She describes issues with migraines, executive function, attention, and consistent with our findings in the qEEG with word finding. So consistent with Therese's description of the accident with the window, you can see where the window hit her head on the right side, impacting her brain as well on the left inner surfaces of the skull and along the midline where the 2 hemispheres meet above the corpus callosum. Now this is a 4-view with the neuronavigator where you can see the axial, coronal, sagittal views and the volume view as well. So this was Therese on the 3rd of December before she did neurofeedback, and then after 15 sessions you can see the changes in brain function. Now, what's particularly important with these, and to show you the consistency, is that the areas of power difference are the same, but they have simply reduced as her neurofeedback program has progressed. So our final example is Richard, age 69, who was riding his bicycle when he hit a pothole, went over the handlebars, and hit the right front side of his head, smashing his helmet and losing consciousness for a number of hours. Since then, he's had significant changes in attention, mood, and social skills. He was assessed in June of 2021, about 2.5 years post-injury, and then again after 21 sessions of SW Loretta neurofeedback. So consistent with the description of Richard's injury, we're seeing very significant changes in EEG power in delta at 3 Hz, measuring minus 2.56 standard deviations from the norm back in June 2021. In these sort of bottom surfaces of the brain on the right side where the brain meets the skull. And then in December 2021, after 21 sessions of neurofeedback, you can see quite a significant improvement with delta measured at just 0.38 standard deviations from the norm. Consistent with that kind of change, there have been very significant improvements in Richard's executive function and in his social skills. So what I hope I've illustrated today is that qEEG is an incredible diagnostic tool, really making the invisible injury visible and measurable. But not only that, that when it's combined with SW Loretta neurofeedback, it becomes a highly specific and effective treatment that we see every day improving outcomes, and we're incredibly excited about it. Thank you very much.